Hey guys, what's up and welcome back to my YouTube channel. So if you don't know me, my name is Joy, okay, and I am a registered nurse. I don't know why I'm so excited for this video, but in today's video I will be telling you different nursing interview questions and best way to answer them. Okay, you might know a better way to answer them, but I'm just giving you some ways to answer those questions. Some of these questions are questions I was asked, okay, by my employer, okay, and some other ones I just went on social media to gather them. Okay, so if that is what you want to watch, if you're preparing for your nursing interview, congratulations to you. I pray in the name of Jesus that you are going to pass it. Okay, if you don't believe in what I believe in, I pray in the name of whatever God you serve that you will ace your interview and you will actually get that job. Okay, so without too much talking, let's just get right into the video. Okay, so in every interview, the first thing that you'll be asked, just anticipate it. The first thing you'll be asked is tell me about yourself. So for tell me about yourself question, you can just start with, they already know your name at this point, so you can just start with maybe your name. My name is Joy. I am a registered nurse. I have a strong passion for patient care, patient-centered care, and find this aspect of the job to be the most satisfying and fulfilling. I have a tendency to be compassionate. Therefore, I appreciate being in a position where I can help others. Okay, just basically tell them about yourself. Personally, I told them I am a hardworking and dedicated person. I told them. They also researched who I was. They knew that I had a YouTube channel and a social media presence, kind of from my CV also, and maybe from their research they knew. So tell me about yourself is one question that is one question that you will always find. Okay, and please, as much as you're trying to make your response look very unique so that they can accept you, please also try to be realistic. Because if you tell them something like, I like to work under pressure, I can work under pressure, and then you are accepted and you cannot work under pressure, it will be like what I ordered versus what I got. Okay, so you can work under pressure, you don't see Abby. So yeah, just basically tell them who you are. Okay, find who you are and just basically tell them who you are. So my second interview question is, why did you choose nursing? So some people will actually ask and some would not ask. I had already prepared myself for this question, but unfortunately my employer did not ask. So why did you choose nursing is a personalized question. For me, I think it's a personalized question. Why I chose nursing might be different from why you chose nursing. So just tell them why you chose nursing. Me, I chose nursing because when I was about to get into nursing school, my dad was, helping me, telling me, directing me, and he passed away before nursing school. Okay, and I usually do not go to hospital. If I'm sick, I'll just go to a pharmacy. That's how it is in my house. And when he passed, it was shocking. When he passed away, I just felt so bad. Okay, I wish there was something they would have done. So basically, that now made me want to become a nurse, and not just a nurse, but a nurse with a difference. So the third question, they might ask you to tell them about your strengths and your weaknesses. Okay, if you don't know your strength and your weaknesses, there is a personality test that I'm going to put in the description box. So just take that test, and while you're taking that test, take that test based on who you are and not who you want to become. Okay, just take that test and you may know your strengths and your weaknesses. So this fourth question, I was asked, okay, so they asked me, what are my short-term goals and my long-term goals? Okay, so one of my long-term goals was to, further my education. Okay, and the other ones, I told them, you understand, they'll ask you your short-term goals and your long-term goals. Okay, so they might also ask you, what skill do you have? What skill did you do in your clinical setting? Okay, but me, I was not asked that question because of my CV already contained a lot. Okay, they might also ask you to tell them about a time or a situation where you worked under pressure. Okay, yes, you would explain that. Just look for something you will explain. Okay, and then so you also be asked, have you ever had a conflict with a co-worker, and if you have, tell us how you resolved it. So I was not asked this question, but when I was writing my exams and I was preparing for my exams, I saw this question and how to answer it. So this is how to answer it. Okay, if you have a conflict with your co-worker, what you should do is go directly to the co-worker, politely have a conversation about it, tell them, okay, this thing you did to me, I didn't really like it. Allow them to explain themselves also, and that is how you resolve a conflict. Okay, if they agree, if they apologize, conflict resolved. If they did not, you avoid them, but you've told them already. So that is how to resolve a conflict. Another question is, so they will always ask you 10 rights of drug administration. Yes, it's a question they will always ask. Okay, so 10 rights of drug administration. Number 1, we have right drug. Number 2, right dosage, right patient, right time, right route, right of patients to refuse the drug, right to know the medical doctor or the nurse's name, right to know, patient's bill. Like, there are so many rights, so just check online for them. And sometimes they mix patient bill of rights with drug rights. There is a drug right they taught us in pharmacology. Okay, so sometimes they mix patient bill of rights with drug rights. So you guys know, rights to know who is the nurse or doctor in charge of your treatment is part of patient bill of rights, but sometimes they combined these things. Okay, sometimes they combined it. So yes, sometimes, like me now, they asked me what are the muscles of the face. Okay, muscles of the face, because it's an aesthetic clinic and I will be dealing with injectables. So I told them the zygomatic muscle, the orbicularis muscle, and all of that. Okay, they asked me to mention 3 muscles though. So another one is, what is the role of a nurse? Okay, this one, there are 2. Okay, we have the 3 main role of a nurse, which are the dependent role, the independent role, and the multidisciplinary role. Okay, and we have another one, role of nurses. The nurse is a teacher, the nurse is an advocate, the nurse is a caregiver, which is the primary role of a nurse. Okay, so yeah, they might ask you that. So another very important question that they do ask, you cannot run away from this one, is guess, just guess. Okay, maybe you guessed right. So the other question they ask is, what is vital sign? Yes, what is vital sign? So vital signs are just body indications of body function. Okay, bodily indications of body function. You might have other definitions. Okay, they will ask you what are the 5 main vital signs. Okay, which other one? Blood pressure, pulse, temperature, pain is the 5th vital sign. I'm trying to remember the 4th vital sign. Oh God, just small school I left. And then they are going to ask you the normal range, like what are the normal range. Okay, so also check that. So another question I was asked was, if you are to administer an intramuscular injection, demonstrate how you would do that. Okay, demonstrate how you would administer an intramuscular injection, IM. So when you are explaining this, try to tell them that intramuscular injection can be administered in the deltoid muscle and in the lateralis muscle, that's on the lap, and also the upper outer quadrant of the buttocks. Okay, so try to explain, then do like a procedure on how you carry it. Take your equipment to patient's bedside. No, prepare your equipment. After you prepare everything, you go to the patient, explain what you want to do to them, seek consent. Consent is very important. Seek consent, administer it. After that, give patient psychological support, thank them, tidy up your environment, and all of that. So they might also ask you, what is confidentiality? Okay, confidentiality is just basically keeping private all patient details and documentation. So the last but not the least question on my list is, if you encounter a client or patient who is refusing to take treatment, what will you do? Okay, you tell me, what will you do? So for me, what will I do? So you can start with, most times refusal to adhere to a prescription or medication just simply tells a lack of understanding and comprehension by the patient. And then you explain further that you are going to make the patient or client understand what this medication is, why we are giving them this medication, what will happen if they don't take their medication as prescribed. Okay, you are also going to explain that. So make sure to explain that to them. So guys, we've come to the end of today's video. Okay, we've come to the end of this video. I hope you found something valuable, because any content I bring out, there's always value. Okay, yes, if you've not subscribed, please subscribe in the subscription button. Make sure to click the notification bell, and I will see you all in my next video. For now, bye.